Hello, my name is Carly Miller. I'm going to show you how to do an enteral feeding. The patient that I'm using today has a G-tube. So I've already assessed the patient's need for the enteral feeding. I have evaluated their nutritional status. We also want to get a baseline weight. A lot of times when people get enteral feedings, it's because they're not getting what they need to maintain a healthy weight. I assess the patient's labs. I assess them for any abnormalities. I'm going to check the site, make sure there's no redness, drainage, any signs of infection, irritation, anything like that. Now I'm going to auscultate for vowel sounds. So I'll do it just like this in all four quadrants for a minute each. I'll now identify the patient with two patient identifiers. I ask them their name and date of birth. Now I'm going to perform hand hygiene. I'm going to don gloves. I'm going to explain this procedure and what I'm doing to the patient. Right. So I've donned my gloves. So I've already had my food, my formula out so that it can be at room temperature. I'm going to check the expiration date. The expiration date is good. Sorry. I'm going to connect my tubing. We don't have that exact tubing, so I'm improvising, but I'm going to connect my tubing to the container. All right. Actually, rewind, I'm sorry. Before I connect the tubing, I'm going to make sure that this is shooken up really well. Make sure that it's shaking good, room temperature. I would then connect the tubing to it. Can you see me? Okay. I'll fill the container with formula as well as the stopcock, and then I'm going to hang it. Okay. I'm going to make sure the patient is at a 45-degree angle. I think you can see him better there. Okay. I'm going to go ahead and do hand hygiene and apply another pair of clean gloves just to be extra safe. Okay. Now I'm going to check for gastric residual. So what I'm going to do, I'm going to get my flush. I'm going to take the end of their G-tube. I'm going to put flush. I'm going to flush it with air from the syringe, and then I'm going to pull back slowly to aspirate any gastric contents. Okay, so I'm pulling back. Now I note how much it is, and then I'm going to give that back to them. I'm now going to flush with 30 mLs of water. So we'll say that this is 30 mLs. So now, I'm going to initiate. Have this sitting in a safe place. So I do want to say, for intermittent feeding, we would use a syringe that we would connect to this, one of the big syringes, and would put in the stuff that we're giving them. This is going to be the actual big thing of feeding, a continuous feeding. So it's a little bit different. So this will pull up. So whenever we put the 30 mLs of water in, I don't have a big syringe, but it would actually be more accurate to show you like this, putting the water. And then I would take that off. I would connect my feeding. I'm going to kink this. Kink this, remove my syringe, apply my feeding tube, my tubing that's connected to the feeding. That's not right.